Welcome to this edition of Around Arlington. I'm Cheryl Moore, and I'm glad you could be with me on this second of a two-part series that we are having with Dr. Joyce Buckner. Now, Dr. Buckner has been in private practice for some 15 years. You've been counseling with couples as far as relationships are concerned for all those many years, and it has brought you to do this set of cassettes, 6 cassettes called New Beginnings, Life After Divorce. We talked yesterday about relationship and the stages of intimacy. And let me see if I can remember this now, Joyce.
All right.
You talked about when we were children and the things that we got from our primary caretaker or didn't get. And that when we were looking for someone else, we're looking for all those, we're looking for another person that can fill the needs, those things that we didn't get from our primary caretakers. Maybe it was, for example, a parent that had withheld a certain amount of emotion or closeness. So when we go out to look for a person that we want to have an intimate relationship with, our little radar says, I'm going to look for this person that's just like my primary caretakers, or gives the same type of, can fill the same type of needs. And then the second stage, and that is when the sparks fly. Now, when you find this person, the sparks fly, you have this romantic love and all.
The better the match, the greater the sparks.
Okay, so the better you match this picture you have in your mind, the picture you got as a child of who is going to fill your needs, then the better the match, the more love,
the more emotion.
Emotion, okay.
Well, exude.
Then, as people connect, say they marry, and they have these sparks and they move along in their relationship, they come to a point where all of a sudden they're looking at the person and saying, you've changed, or in other words, you're not meeting my needs. And those are the two stages, and that's where you said that marriages break up. And 50% of all marriages right now at this point in time are ending in divorce, which is really a sad state. But they primarily end in that stage?
Yes.
So what do we do, Joyce? I mean, you know, it's almost like there's no hope, because you told me, if I'm correct on this, you told me that we're always going to match up with that picture, with that, someone like our primary caretakers to fill those needs.
And of course, matching our inner picture, Cheryl, means that we've picked someone who not only has characteristics similar to our primary caretakers, which met our needs, they must also have characteristics similar to our primary caretakers, which did not meet our needs, as you mentioned.
That's right.
So, anytime you're attracted to someone, that person is going to be inclined to not meet your needs in exactly the same ways that they were not met when you were very young.
By your primary caretaker.
That's right. And that's what I call your unfinished business. The wounds that each of us have are in the arenas where our basic intimacy needs were not met by our intimate. So if we're
always going to match that picture, we're always going to end up in the same place, at the same stage.
Yes.
Everyone, all relationships.
That's correct. And some people say, well, gee, Joyce, why can't we just connect with someone who's going to give us what we really need?
Why can't we do that?
Well, you can. You can make the choice, just intellectually say, okay, I'll take you. The emotion will not be there.
There'll be no spark, will there?
So it would be boring, and most people are not willing to do that. There is hope, though, Cheryl. But in order to move beyond the power stage, and incidentally, many people stay in the power stage all their lives. And you may know some people like that, who just continue to be unhappy in their relationship. They may stay married or they may stay connected, but with the junk going on.
They just put up with it.
Yeah, and they suffer. To ever move beyond the power stage requires conscious choice. Now, these first few stages of relationship, attraction, the falling in love stage, and power, the power stage, are what I call natural stages of intimacy. Because we will naturally move into those. Those are the only two stages we've experienced as human beings. Those are the stages we experienced when we were infants. But we never moved beyond those. So we don't know how to move beyond those.
And you mean you can
yes,
move beyond those?
Yes. If you're willing to be taught how to move beyond them. The third stage we call awareness or awakening. And in order to move into this stage, Cheryl, you must learn something new, something different from what you thought, from what you believed about relationships.
Now that is difficult for many, many people.
It's scary.
It is scary.
And it requires tremendous courage, Cheryl, for people to be willing to move into the unknown, which is incidentally one of the reasons that I think therapy so often is necessary.
It is a help. Mm-hmm. It is something that you can work through.
We need some guideposts because we don't have our own guideposts. Doing what we thought is what got us where we are. And we'll keep getting to that same place in relationships over and over.
And then it will, you'll come up against a roadblock because normally, most of us don't know how to work beyond that.
That's right. You begin to get the feeling, I've done all I know to do and it just doesn't work. And that's when we typically will end the relationship in one form or another. So what does work is to literally learn about your partner and what their needs in intimacy really are. And they will not be what you think.
We're going to be surprised.
We're going to be surprised. And we don't believe that. You know, most people think, well, I know him, you know, or I know her. And
I've lived with them for 18 years or whatever.
That's right. And what they want is, or what they need is, or what... but we don't. So each of us is literally the expert in terms of our pain, in terms of what it is that we want and need from our intimate. So you must each explore within yourself, what is it that I really need from my intimate? And our needs are tremendously specific in this area. It's kind of like an itch, Cheryl. Have you ever had an itch back somewhere where you couldn't reach? And you might say, would you scratch my back? And someone is scratching on. Say, no, over to the right a little or up a little. And they must scratch you just right. And then it's, that's the way our intimacy needs are. Our intimate must do what we need them to do in exactly the way that we need it. And then it's the, that's it. And now I feel loved.
But to work to that point
requires that you figure out what it is that you need and that you communicate it very clearly to your partner. And they figure out what they need and communicate it clearly to you.
And to be able to do this, both members of this relationship, those participating in this relationship, have to be willing to do this.
Yes.
It can't be done by one.
No. It's a process that must be reciprocal or it's impossible, Cheryl. And I occasionally will have one individual who will come in my office and say, Joyce, my marriage is really a mess. I don't want it to end. My husband won't come in or my wife won't come in. Can we just do things so that I can fix it? And the answer is no. Only if both people are willing to work through their own unfinished business can it happen. And what you need must be received. We can't just be big people and say, oh, well, gee, that's unreasonable, I'll just not need that. That's not possible for us. In the arena of our wounds, you must get someone who will hold you in the way you need to be held, or give you space to go do your own thing, or whatever it is, in order for you to feel loved and connected to that person. And they must have exactly what they need from you in order for them to feel really loved by you. So the stage of awareness is a stage in which you learn your needs and communicate them to your partner, and they learn theirs, communicate them to you. And then as you are each willing to do that, you can literally transform the relationship and move into what we call reality love.
So there is the hope.
Yes.
If you can get two people that are willing to move into that third stage, that are willing to work at that, to try to communicate and to try to understand, but it takes two people.
And it takes working. It is not easy, Cheryl.
It is very interesting to know that we will continually, no matter what, who the person is, we will continually connect with that person that we have as that picture back in our childhood. So we can't change it there. We will continually do that.
Yes, and we always think we've chosen someone different this time. Because maybe their hair's a different color, or they seem different to us in some ways, and they are different in some ways. It's just that they won't be different in the ways that matter. So what I tend to tell people, Cheryl, is you might as well work it out with this one, because if you don't, you're going to come to this same frustrated place in your next relationship, or if you choose not to have another intimate relationship, you're stuck with the pain of no intimacy. So we can't skip the pain, Cheryl. We can choose the form of it, though, and the potential payoff for it.
And we can continue to grow if we can move into that other...
One of the really neat things I think about this is that as you work on the relationship, you also are working on completing your own growth. It is not a question of giving up myself or giving up the relationship. They go together. It's either a win-win or a lose-lose. If I really...
If you don't, then you won't.
Yeah, right. If I work on the relationship and am willing to stretch myself in ways that I'm not inclined to stretch, then I'm actually developing a dark side of myself, a recessive side of me that needs to be developed. So I'm becoming more whole within me as I give to you. I'll always choose someone who will help me do that.
Very interesting. Well, we have to take a break right now, but we're going to come back and talk more about these particular tapes and new life after divorce. Welcome back to the second portion of our show. I'm talking to Dr. Joyce Buckner. This is our second show that we've done on divorce and is there life after divorce, and we know there is, but there is a statement, Dr. Buckner, that says, well, I was wondering, why can't I fix my feelings? Why can't I do this? Why can't I work through it and make myself feel whole? And they say, because they say, unless you are a whole person, you cannot have a good relationship, unless you are whole. Unless you bring to that relationship, this whole, well-rounded individual.
You sound like some of my professors from the 60s, Cheryl. That's what we were taught, the meism, that I can fix me, only I can fix me. And indeed, we can do a lot of work that helps us to grow as a human being. There is some work, however, that we cannot do alone.
Well, this is what's shocking. You're telling me that only our intimate can fill those needs, those wounds that we got as children.
Only as we get those special needs met will our wounds be healed. And our intimate is the only one who can meet those needs, and therefore is the only one who can be our healer.
So trying to make myself whole is an impossible task for me.
Yes.
That's a relief.
Alone. Yeah. Isn't that nice?
That's a relief. I mean, you know, folks have been trying to do this and failing, what they considered failing, for a long time. Why can't I make myself whole? You know, I should be able to do this.
Yeah.
That's a relief.
Yeah.
It's a big relief.
I think my profession has served a disservice in teaching people that you ought to be able to do whatever it is all by yourself. And in these very deeply wounded parts of us, we can't get there, Cheryl. We do not have access to those parts of ourselves. Now, we have access to most of the information that we've recorded in our cerebrum, in that part of our brain. But these wounds, the kinds of wounds that we're talking about, which continue to get activated in our intimate relationships, were caused long ago when we were infants, and therefore are recorded in what we call the unconscious part of us. We do not have willful access to the unconscious part of ourselves. But we
our computer has two parts. The one part we can get to and the part we consciously can get to and the part we can...
We'll do a quick little physiological thing here, Cheryl, making clear that this is a sliver, and I go into this in quite detail on the tapes, so that people can really understand that there's scientific basis for what we're saying here. This isn't just philosophical.
And you know, from the tapes, Joyce, this is what I got most out of those tapes, is there was some scientific data and knowledge that you give us, and I might not have understood it the first time, but I could take this tape, put it back in the machine, and work through it. And it was comforting to know that there is some scientific basis to all this, the way I'm acting, or the way, you know, we act when we get in and out of relationships.
Isn't that wonderful to know that I wasn't crazy after all? I acted crazy.
So give me the sliver so we can give the folks at home there, because they're going, what is she going to say?
All right. The three major parts of the brain, I'm using Paul MacLean's model, an evolutionary physiologist. We have the little brain stem, which is really the very primitive part of the brain, and that controls the autonomic functions, breathing and little things like that, you know, heartbeat. Then curved on top of our brain stem is a set of structures, Cheryl, which is called the limbic system. And that part of the brain I'll come back to in a moment. Then in a concentric layer over the limbic system is the cerebrum. And most of us, when we think of the brain, you know, the left and right hemispheres, etc., we're thinking of the cerebrum. But I'd like for us to go back and talk for a moment about the limbic system. Now, in the cerebrum is where our intellectual thought processes occur, logic, reason, intuition, and so on. However, this little limbic system, which makes up about 1/5 of the brain, is the glamorous system of neurobiology today. It is the part of the brain that is presently really being researched. And a few of the things that we're finding is that, of course, in the limbic system, and there are a number of structures there, the hypothalamus is one of the ones that is most probably readily known, but it's within this area that feelings are literally created. So the brain is not only what I think with, it is also what I feel with.
And we've always thought you feel with your heart and you think with your brain.
And incidentally, any kind of mood altering substance is a mood-altering substance because it affects the substances that are secreted by one of the structures in the limbic system. Well, early on, when we were having those little interactions with our parents when we were infants, that material was recorded in limbic system tissue, so it's very deeply recorded. And I suspect that the limbic system is as close as we get to a physiological home for the psychological term of unconscious. So this unconscious part of us, this limbic system material, is pretty much unavailable after about 6 years of age. We don't make new recordings in that part of the brain, for the most part. But we can fool our little limbic system. You remember earlier I mentioned that there's a deep part of us, a limbic system part of us, that thinks that our lover is our primary caretaker.
Right.
You know, we project onto them the image of the primary caretaker. So at a deep level, we literally believe that we have reunited with our life-saving parents. So the limbic system opens up to the intimate. And the way the intimate behaves that stuff is recorded in the limbic system. And so those wonderful feelings, even when you were attracted, actually are emanating from limbic system. That's why they are so intense. And that's why we feel so wonderfully alive.
Before, we only have a couple of minutes, and I want to make sure we get this phone number on the screen one more time. If you are interested in the tapes, 1-800-835-2246. That's extension 251. It's 1-800-835-2246, extension 251. You can get these at Taylor's Bookstore here in Arlington. Now I'm going to ask you a question. The price. It's really cheap.
It really is, Cheryl.
I mean, really, for what you get. And I'll be honest with you, Joyce, I have talked with many a professional that sat right where you are, and we've talked about divorce, and I've read a lot about it, and it's really been a topic that I've kind of delved into, and I thought when I picked this up, I thought, will I be able to, I can't learn anything from this. I'm sorry, they're not going to tell me anything new. Was I surprised? I was so surprised. Number one, because of that scientific knowledge that you bring with it, that you make easy to understand on the tapes, and those particular things that I did not know. All of those things go together to make a whole complete picture of things that I had been thinking but was unable to figure out for myself. This is wonderful. You've got to try it. And how much are they?
$59.95, Cheryl.
You can't beat it. That's less than a counseling session with your local psychologist or psychiatrist. It's interesting, and I know that we've only been able to give the folks here today just a small slice of what is actually going on inside you when you have a breakup in a relationship. And but we have to leave them with this note. You can work through it?
Yes.
If both parties are willing to do that?
Yes. And on the tapes, we talk about working through your own pain, even if your partner's gone.
So you can get help, whatever type of help it is that you need. I appreciate you being with us these past 2 days. It has certainly been an enlightening series, and we hope that you all enjoyed it as well. And we hope that everyone at home is going to join us here on Around Arlington very soon for equally exciting topics, we hope. Meanwhile, until we see you again, this is Cheryl Moore saying good day to you, and remember, take very good care of yourselves.